my name is Angela, and I'm going to be your nurse for the day. Could I see your wristband? Could I have your name and date of birth?
Rachel LaFave, 8896.
All right, and how are you feeling? Any pain today?
No, I feel good.
Any allergies you need to know about?
No.
Okay, perfect. And then do you know what year it is?
2016.
Perfect. So my patient is alert and oriented times 3. She appears to be her stated age. Her affect matches her, like the environment and her mood. And then, okay, so her affect matches that. She doesn't appear to be in any pain or show any illnesses from what I can see, so that's all matching to what she said. So I'm going to do a head-to-toe assessment on you. I'm going to start with the head. So I'm going to just palpate your head. Do you have any tenderness?
No.
All right, and I don't feel any bumps or any abnormalities on there. It's symmetric on both sides. Your hair is evenly distributed on both sides. Doesn't appear to be dirty or have any living organisms in it, which is always a good thing. So her hygiene looks good. And then, so after that, that's all good. I'm going to move on to your face and eyes. So I'm going to start with, I'll check your eyes first. So I'm looking at them first. All right, your pupils are they're the same size on both eyes, and they're both round, which is a good thing. And I'm just going to shine a light on them to see if they constrict. Good. Same with this one. Sorry. Good. So when the light is shown on your eyes constrict, it shows that those, your cranial nerves are working properly on that. And I'm just going to have you follow the pen light into your nose. Good. And then I'm going to have you keep your head straight, but just move your eyes and follow the light. And then just 2 more. Perfect. You're able to do that so that those cranial nerves are all working well. So after that, I'm going to have you close your eyes, and I'm going to touch a few places on your face, and just tell me where I'm touching.
Forehead.
Yep.
Cheek.
Yep.
Chin.
All right, so that's your cranial nerve number 5. So that shows that your facial muscles are working properly. And then I'm going to have you give me a big smile, a frown, and puff out your cheeks. Okay, perfect. So those are symmetric on both sides. There's not one that's not working properly. So that shows that cranial nerve number 7 is working properly. And from there, I'm going to look into your mouth. So I'm just going to check your teeth and stuff first. Perfect. Doesn't look like you have any dental work. Your teeth are white. Your tongue and your mucosa are moist and pink. So now I'm going to have you stick your tongue out and say ah. Good. Your uvula is midline. You haven't moved up when you said ah. And then your tonsils were not swollen or anything. So I would grade them as a 1+, which is what we want. And then your gums, they were good. There was no bleeding, no edema, nothing out of the ordinary there. So I'm going to move on to your neck. So if you can put your head up for me. All right. So your trachea is midline, which is what we like to see. And now I'm going to check your carotid pulse. And then this one. Okay, good. It was, I would say it's a 2+ on both sides. It's a normal, it's a good pace, and it's both like equal strength on either side. And now I'm going to actually listen to your carotid pulse as well to look for any abnormalities there. Good. So I didn't hear any bruise or anything like that. It shows that everything there is working properly. And now I'm going to move to your arms. So I'm going to just look on both sides. Your arms look like there's no bumps or any abnormalities on either of them. Oh, you're okay. Temperature-wise, they're both good. They're dry. They're the right color for your ethnicity. And then if you go this way, I'm just going to feel for your pulses. So this is your brachial pulse. Good, I have them on both sides. They're symmetric. They're both beating at the same rate. So those are also both the 2+, which is good. And then I'm going to check your radial pulse. Those are also both bilateral. They're both symmetric that way. And those are also a 2+. So now I'm going to check your capillary refill. Okay, good. And those both filled within less than 3 seconds. So that shows that you're having good blood circulation through your body. And then can you squeeze my fingers for me? Good. You have equal strength in both arms, so you're not showing any weakness on one side for some reason. And then I'm going to push down and have you push up. All right, and now the opposite. Good. Okay. So after your arms, I'm going to listen to your lung sounds, and I'm going to start with your back. Sorry. All right. So when I place the stethoscope on your back, you could just take a deep breath for me. All right, and then if you could put your arms out in front of you like this. All right, one more deep breath. And same thing over here. All right, perfect. So for the posterior side of your lungs, your lung sounds were clear in all 4 quadrants. There was no wheezing, no anything like that that could signify that you have pneumonia or something else. So that's always good. And if you could lean forward for me. All right. Your spine appears to be very straight, so there's no scoliosis or anything there, which is what we like to see. And then I'm just going to pound on my hand and let me know if you have any tenderness.
No.
And how about over here?
No.
All right, perfect. And now I'm going to check your lung sounds in the front. All right, so same thing. I'm just going to have you take a deep breath when I place my stethoscope. Good, so those long sounds, just like the ones in the bag, they're both clear, didn't hear any wheezing or anything. And so now I'm going to check your heart sounds, so you can just breathe normally for this one.
Okay.
And I'm going to start over here with the aortic. And this is the pulmonic. And this is Erb's point. And down here is tricuspid. And over here is mitral. All right, so from what I heard, you had a regular heartbeat, regular heart sounds, nothing that would indicate that you have a murmur or anything wrong. And then down at the mitral point, that's where I would listen for a minute to check your apical heart rate. So now I'm going to listen to your heart sounds again, but with the bell of my stethoscope to see if, to listen to duller noises. All right, perfect. And again, just like the first time, those ones were all normal as well. So I'm going to check your abdomen. So if you could lay down over here for me. Okay. All right, so from looking at it, I don't see any abnormal scarring, no lesions or open wounds that would be a problem. Your umbilicus is midline, and I'm just going to check it for temperature. All right, and it's good, and it's not moist. You have nice, like, dry, intact skin, which is good. That's what we want to see. And so now I'm going to listen to your bowel sounds to see if those are functioning properly. So I'm going to check your right lower quadrant first, which has regular bowel sounds. Okay, so in all of your quadrants, I heard the proper bowel noises, little clicks, and show that everything's working properly. And so in the right lower quadrant, that's where I would find your appendix and your right ovary. In your right upper quadrant, I would find your gallbladder and your liver. I said right upper quadrant, I don't know if I said that. And then your left upper quadrant would be your pancreas and your stomach. And then your left lower quadrant would be your left ovary and your sigmoid colon. So now I'm just going to, I'm going to listen to hear some of the noises. Okay, so in the right upper quadrant, there was dull noises, but that's normal over the liver, and everything else was tympanic. So that shows that everything, from what I can see, is where and how it should be. And so I'm going to have you sit up for me. All right, I'm over here. I'm going to look for any JVD, so if you could look that way. All right, I don't see anything, and look that way. Okay, good. So no jugular vein distension. And so now I'm going to check your lower extremities. I'm going to look at your legs. Oh, perfect. All right. And so from what I can see, you have, there's no bumps or anything on either side. They're both symmetric. I don't see any edema in your ankles or anywhere else. Temperature-wise, they're both good. They're what they should be. They're the same on both sides. And there's no moisture, so it's dry and intact skin. So I'm going to check some of the pulses in your legs, and I'm going to start with behind your knee for the popliteal pulse. Okay, good. I would say that's a 2+ on both of the sides, so that's nice to know that's good. The same on both sides. And then I'm going to check your dorsalis pedis. I think the first one. Alright, so your dorsalis pedis is also a 2+. It's the same on both sides. And I'm going to check your tibialis pulse over here. Good, those are also the same on both sides, and I would grade those as a 2+ as well. And I'm going to check your Babinski reflex, so if you could curl your toes. Yeah, and then this side. Good, so those are all intact, and that's what we want to see. You want to see them uncurl. And so from there, I'm going to check, I'm going to have you stand up for me if you could. Good, so my patient was able to get up on her own and stand. And then I'm going to have you close your eyes for me. And so this is what we're going to check to see if you have your proper balance. We do this for about 20 seconds, and it doesn't look like you're swaying or wobbling or anything. Okay, so I'm going to stand over here, and if you could take a few steps towards me, and then do the same thing and walk back that way. So that was me checking your gait, and your walk looks steady, it's balanced. There's no favoring one side or the other. So for my head-to-toe assessment, I would say that my patient is healthy.